Wish I could help you, Sarah, but I'm a family doctor and you're an orphan. Oh my God! That was just downright mean. Pre-med student reacts to funny medical memes. Let's get right to it. Perform CPR. Cardio workout is done for the day. Dude, this is so true. CPR is a workout. So the other day we were actually doing certain scenarios of what would happen with a patient in EMT. And I had to give the patient 30 different cycles of CPR. I was drenched, I was sweating. That's a cardio workout. My face while studying for EMT National Registry. That's funny. That EMT National Registry is designed to be a difficult test. So the way it's set up is, I have like a bunch of questions, probably like 200 or like 100 questions. And it'll give you a bunch of questions from different topics. And if you get a topic wrong, it's gonna give you harder questions from that topic. Check if you know your knowledge from that topic. So it's pretty difficult. And then once you're done, it'll just stop. If you failed or if you passed, it'll just stop. And you really don't know if you passed or not because it really won't tell you. So it is a difficult test, but I'm excited to take it. I'll keep you guys updated on it. What you think EMS will be like? What it's actually be? I got the poo on me. So I really don't want this to happen. My instructor tells me how like they see all these crazy things on the road, which I want to see like all the pain and all the blood, and I don't mind that stuff, but the poo, not a big fan of. Can't wait for that. People just don't know how hard it is being an EMT. These cots don't make themselves. She's all sweaty, or he's all sweating. I don't know, I can't really tell. But prior to taking a cot, you actually have to make it, you have to make it all neat. A lot of people just kind of throw it around and make it however, but some people will get irritated if you don't make it right. And they do take a lot of work. I mean, especially after you have a long day of just taking cots everywhere and you want to make your cot, it's gonna take a lot of work. So, tell me everything you told the nurse 5 minutes ago. So this is funny. The reason I feel like this happens is because doctors are usually so caught up in everything. So I do feel like nurses do typically give doctors an oral report before they go into the room. But doctors are so worked up with everything, they just kind of forget everything before they came in the room. So I guess that's why they tell them. But don't you guys hate that? Whatever. DR. You're going to feel a little bit of pressure. Ready? Me, yes. DR. Your sister is younger, but already has a career path and owns her own. Not physical pressure, you're gonna feel the mental pressure. That's funny. Doctor, are the results of the test ready? I'm dying from curiosity. Not only from curiosity. This is funny. Poor guy. He's dying from many things. Doc, I have bad news and worse news. The bad news is you have 24 hours to live. And the worst news? Doc, I meant to tell you yesterday. Oh my God. That is so bad. That means he could die any second now. That one's funny. The look you give when someone says it sure is quiet. Never say it's quiet. I never had to witness it, but I heard when you say quiet, everything storms in. When a medical student forgets his headphones home, you gotta break out the stethoscope, don't you? That's funny. So, do you like touch my balls first, or how does this work? Steven, I'm your dentist. Okay, this isn't right. Dentists typically don't have stethoscopes, so I'm not buying it. Not buying it. And then I said, the doctor will be with you in a minute. You know when nurses come in, they say the doctor will be here, and you're sitting there waiting for like 30 minutes to an hour, and the doctor still isn't there. And then come to find out this is what nurses do. That'd be funny. I wish I could help you, Sarah, but I'm a family doctor and you're an orphan. Oh my God! That was just downright mean. If you guys don't get it, I'm sure you get it, but because he's a family doctor and she's an orphan family, and yeah, you guys get it. Driving an ambulance without a patient, with a patient. So me, I haven't even drove in the ambulance yet, but I can't wait to get on my first road. A lot of people that are already EMTs now or paramedics, they tell me stories about how like when someone's in the car or like a patient's in the car, they start driving like an Uber driver, but without a car, they're just all over the place, reckless driving. And people know that ambulance drivers are reckless drivers. I mean, come on. We gotta get them there as fast as possible. That's our job. Doctor, we couldn't save his hand in the surgery. We're sorry. You said he was going to be all right. Well, his left hand is gone, so he's gonna be all right. Get it? Left hand gone. All right. This is funny. These memes are funny. Doc, it hurts when I touch my shoulder. Then don't touch it. That'll be $60. You guys know what it is. When you go to the doctors and you ask for something and you're expecting certain treatment or something and they just give you some simple answer like eat right or just drink plenty of water, drink many fluids, and then they just charge you a lot of money for it. Sometimes doctors are saving a lot of money because people go in and they're gonna spend money on medications and treatment, but sometimes you don't even need that. So doctors are doing you a favor sometimes when they just give you these simple treatments that are gonna make you feel better. So even though this is kind of crazy, I'm with the doc on this one. Who are we? Doctors. And then it's got the scribble because doctors have the bad handwriting. See, I don't have bad handwriting as of right now. Me personally, I have many different types of handwriting. It's kind of funny. I can do 10 different types of handwriting, but my fast handwriting, I guess it's kind of sloppy, but it's nothing like this. You can definitely read it. So I haven't really seen many doctors with bad handwriting, but guy, I broke my arm in 3 places. Doctor, well, don't go to those places. This is funny. I am definitely gonna use this one day. And then they're just gonna get mad at me, but this is definitely very, very funny. Doctor, my husband wants intense sex all day. What can I give him? My number. Wow. As if the medicine wasn't good enough. Wow. This doctor's a player. She's really getting in there at the wrong time. Putting on gloves alone in front of another doctor. This is so me! Oh my god. So if we do a certain procedure with the class and I put on gloves, I put them on with no problem. But if I'm the one that is in front of the class presenting something, everyone's watching me, it'll take me probably 10 minutes to get on my gloves because my hands start sweating. And if you guys haven't done this and if you haven't gone in front of the class, you're gonna feel this. You're gonna know what this means. This was horrible. Everyone's laughing at me like he doesn't know how to put on gloves, but I do. I put on gloves amazingly. And for some reason, my gloves, the medium size is too small and the large is too big. I don't even know what size to wear anymore. But yeah. So that concludes today's video. I hope you guys enjoyed. If you guys want to see a part 2, be sure to smack the like button on the bottom and comment down below and let me know what you guys want to see. I had fun doing this, and if you guys enjoyed, let's get on to another one. I'll see you guys on the flip side.